A lot of people out there that are receiving not so welcome letters from the Social Security Administration about their Medicare Part B and their Part D, their drug plan monthly premium. They're being charged extra for Part B and Part D, the prescription drug plan. And that is called IRMA. And so we're going to talk about that today. This is the government. They got to have a long acronym about everything. So this is called the Income Related Monthly Adjustment Amount. And so we'll talk about what it is, how it's kind of calculated, can you appeal it, and some different situations. All right. So if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. And in my semi retirement, I'm helping y'all get everything you're entitled to from all things Social Security, Medicare, retirement, disability, Medicaid, all the rest of it. Make sure you subscribe and like and all that kind of good stuff so this information goes out to more people. Let's talk about that. And then this is also going to be a live Q&A. If you're watching this later on a recording, you're like, wow, this takes an hour to do. No, it should only take about 10 minutes to talk about the IRMA, and then I'll open it up to any questions. It looks like I've already got a bunch of questions there, and you can ask anything about all things Social Security, and we'll see if we can help you out, you and your family, get everything you're entitled to. All right. So, I've done this a few 100,000 times. My office, one of the busiest in the country, and so we've had a lot of IRMA. This is the IRMA season. This is the time of the year when everybody gets these letters. And okay, so um, pretty much everybody pays for 2025. They pay $185 a month for their Part B premium. And when they sign up for the Part D, the drug plan, they pay whatever premium is, whatever plan they sign up with, whatever company. Um, so that's the base, $185. But other people pay more than $185, extra $100, $200, $300, $400. It depends on that particular person's income. So that's how it's determined. This year, 2024, it's 103,000. Anything over 103,000 if you're single, 106,000 if you're married. For 2025, the numbers have gone up a little bit. For 2025, if you're single, you made over $106,000. This is 2 years ago. So this is 2 years ago, prior years. It's not this year, it's the last year. And you're saying, why is it 2 years ago? Well, this is December, and Social Security, Medicare has to, figure out your premium. They can't do it based on this year's earnings, this year income, because you haven't finished the year yet. You probably won't be able to do your taxes until February, March, April, May, or something, and then it's too late, and it'll be the following year. So that's why it's 2023 affects 2025's Part B premium, and so everybody is getting their letter about right now that says, okay, for 2025, your monthly Part B premium is going to be this amount. Okay. All right. So if it's over 106,000 for 2025, then you're going to get the extra premium. If it's over 212,000, if you're married, then the extra Part B and Part D premium. And so again, it's based on your Magi, whatever people pronounce it different. It's basically your adjusted gross income, and then it's a modified adjusted gross income. So how do you know what it is? You look on your income tax, your 1040, and there's two lines. The 1040, that's basically your AGI, and then 2A, which is basically tax exempt interest. So you add those together, and that's how you determine whether you're over the 106 or over the 212. And however much you're over that determines how much you're going to have to pay for the extra Part B premium predominantly. And this is only for 1 year. So in 2023, if you're single, you made $200,000, then your extra Part B premium will only be from January until December of 2025. And then for this year, if you made over that again this year, then it'll continue for the next year. So they look at it every single year. A lot of people mistake these with this extra Part B premium with the penalties. So if you sign up for Part B, but you do it late, you don't do it when you're supposed to, then you're penalized 10% for every 12 months you go over that time frame. So if you're 5 years old, 5 years over, then you have to pay a 50% penalty on top of the Part B penalty on top of Part B premium. So that's a completely different thing. You don't have this is also the season. A lot of people are starting to retire starting January, and they're losing their health coverage from work. So if that's your case, if you're 70 years old and now you're going to stop working at the end of this year, and you're not going to have health insurance from your current work, yours or your spouse's, starting in January, then you have to sign up for Part B. If you're already receiving benefits, then usually if you're about to turn 65, your Part B they automatically sign you up for the Part A and the Part B. You can actually refuse Part B. Um, Again, if you have insurance from current work, we're not talking Cobra or the Affordable Care Act or retirement plan. It's through current work, yours or your spouse's. If you have current work and your employer has 20 or more employees, then you are not penalized. You do not have to sign up for Part B. You do not have to waste your money on the $185. But if you don't, then you do. And that's where that extra penalty. Okay. The IRMAA is a completely separate beast. That is for the high wage earners, the extra premium. Congress started this many, many years ago to kind of help shore up Medicare. Because Medicare, just like Social Security, the trust fund is, it needs to be addressed, and this is the one of the ways they decided to address it. Okay, um, can you appeal that? Yes, if you receive that letter, on the bottom of the letter, it gives you a couple opportunities to appeal. You can do an SSA 561, which is a request for reconsideration, which uh, in for these that really doesn't help. Um, in order to get your premium adjusted back to the $185, you have to have what's called a life changing event. And the life changing event is, yes, back in 2023, I did make $200,000, $300,000, whatever the case may be, but I have since stopped working since that time. And that is a life changing event. So you submit that. It's the SSA 44. Always have to have a form, right? SSA 44, you submit that and they will bring it back down. If you missed doing that when you were supposed to, if you don't get around to it, like, February, March, April, July, or whatever, and you submit that and they find, oh yeah, you do have a life-changing event, we should have never charged you over the $185, then they will stop charging you going forward, and they'll give you any money back that you paid over prior to that. So a life-changing event is that, again, you stopped work or you got divorced, and so the other income is no longer in. That you lost a income producing property. The company that was providing you retirement went bankrupt, so you're not receiving retirement money anymore. There's just a few situations, and one of the things that Congress never made a carve out for, an allocation for, was the sale of a home. So if you have a principal home, and I was reached out to a CPA today and said, "Hey, you're doing IRMA. Make sure you tell this." I usually don't give IRS type advice because I never worked at the IRS, but this gentleman is very trustworthy. So he says, if you have a principal home, you sell your principal home. If you're single, you don't have to pay taxes on that up to $250,000. If you're married, $500,000. So that doesn't even go into your 1040 line 11 or 2A or whatever. I guess line 11 on that particular case. So anything over 250 or 500, that is considered capital gains, and then it will go in there. And people ask all the time, well, that was just a one-time thing. I'm not a high income wage earner. It just, we had the family home, we raised the kids, and now we want to downsize. So we sold it. Sure, we made a lot of money, but it was only one time. Can I appeal that? Yes, you can appeal. Will you win? No, unfortunately. Congress did not make that consideration. They should have said, hey, a one-time sale of a home doesn't trigger the extra Part B premium, but they didn't. So unfortunately, we're stuck. And the Social Security employees that get the SSA 44, they're stuck too. If it's so my CPA friend said if it's not a principal home, if it's like a second home or something like that, then there is no exclusion or anything like that. So it's the full capital gains. So I got another email yesterday from someone asking that, well, they had to take some money out of their 401k and that was only a one-time thing. Yes, unfortunately, that also triggers the extra Part B premium. But remember, it's only for 1 year, but hey, an extra $100, a month for 12 months, that's $1,200. I know that's no consolation that it's only for 1 year, but it is only for 1 year. So get with your in terms of the details, what goes in 11 line 11, or what goes in line 2A, municipal bonds, tax exempt, all those type of things. I don't, I try to stay in my lane. I wish a lot of social media people out there would stay in their lane and stop talking about Social Security if they know nothing about Social Security. I know nothing about the IRS. I've been trying to cancel my subscription to the IRS for decades, and so I will take my IRS advice with a grain of salt. Reach out to your financial expert on that and what should go in line 11 or line 2A. All right. So yeah, in terms of if you're going to file for the and another thing is one thing I've seen sometimes people they say we sold a home and we were working and that together put us over. Um, but the sale of a home was only about 100,000, and then we stopped working. So that's a life-changing event to stop working. So if you add those two together, the sale of a home and working, that puts you over, and you're like, what Ed said, you can't file an appeal for the home. Yeah, but you stopped working, so maybe the work thing will put you under the cap there, so they can go ahead and do it. So as I say with anything federal government, anything Social Security, if you think you are in that gray area, please file a reconsideration, an appeal, file a claim, because there's exceptions, the exceptions, the exceptions. And that's essentially why I'm doing these videos all the time. And speaking of that, let's get into the Q&A portion. So if you're just here for the IRMAA part, have a great day. Make sure you share and like and all that kind of good stuff. Um, but let's get into the questions. Lisa, I have noticed that my Medicare Part B coverage did go up. It seems to be all about the money. They give and take away. Yeah, a lot of people got hurt because the COLA, which is it's not any political party that determines the COLA. It's based on the Bureau of Labor Statistics. They do a calculation. I think the calculation should be adjusted, but this is the calculation that's been used forever. But they took it out of the political sphere in the early 1970s. So you can't blame this president, or you can't blame Biden or Trump or Bush or Clinton, Obama for the COLA. They have nothing to do with how much the COLA is. It's based on just calculations. The calculation should be changed going forward, but yeah, for next year it's 2.5%. The COLA, and Medicare Part B went up about $10. So some people say, wow, they actually lost a couple of dollars. Yeah. Yeah. All right. Let's see. I think not everything affects your IRMAA. If you make a withdrawal from a traditional IRA and report it on your taxes, it doesn't affect anything with Social Security or IRMAA limits. Not 100% sure. I think a Roth IRA, but again, reach out to your IRS person, your tax accountant. I think a Roth IRA does not. But again, um, I am not an expert in taxes. Yes, thank you very much, Tweety Bird. Appreciate it. Let's see. Oh, I have a company paid employees stock ownership plan worth $20,000 coming due next September. Now, if I ask for help, I'm afraid the government will take it. Um, yeah, I mean, might have to pay taxes again. That's a tax type thing. So surely, I turned 65 last June, but I didn't want to start collecting Social Security until I reached full retirement age. Yep, that's fine. Yep. Um, but if you turned 65 last June and you did not have health insurance from current work, yours or your spouse's, and that employer did not have 20 or more employees and all that good stuff, then you had to sign up for Part A and Part A and Part B. So hopefully you did that. Medicare is automatic in some situations. So if you're currently receiving benefits, Social Security retirement benefits, spouse benefits, survivor benefits, whatever the case may be, and then you're about to turn 65, that means you're already on the record, you're already receiving cash benefits from Social Security, you're about to turn 65, they will sign you up for Medicare automatically. Part A and Part B, they'll send you everything in the mail. And at that time, you decide whether you want to keep B or not. You have to keep A. Um, but B, if you don't want to pay the $185 and you have health insurance from work, then you return the card. But if you go ahead and get Part A and Part B, then I highly recommend. That's why I partnered up with Chapter of Medicare. They can help you because Part A and Part B is great. That needs some improvements, but there's a lot of gaps. The big one is Part B. There's a 20% co-insurance. So that means if you go to the doctor or something, you get a $100,000 Band-Aid, then Medicare pays 80,000 of it, and you have to cough up the other $20,000. So that's why people either get a Medicare supplement plan, which are the ones I recommend. Always, always, always look, if you're new to Medicare Part B and you want to find a plan to cover all the gaps, always start with Medicare supplement. Look at a plan N and a plan G. And then if that's not right for you for whatever reason, then go down the list and check out a Medicare Advantage. And Chapter can help you with all that. So if you don't sign up for those, if you don't sign up for a Medicare supplement when you're first eligible for Part B, then you might have to go through health underwriting later, and it'll be far more difficult, if not impossible. So, and if you're signing up for Medicare supplement, what a lot of people miss, if you get a Medicare supplement, one of the N and the G's, you also have to get a Part D plan, the drug plan. People say, well, I don't want one because I don't take drugs. Okay, that's fine. We'll just get the cheapest one you possibly can. Because if you don't, and then a year, 2 years, 3 years later, you're going to get penalized 1% for every month you did not sign up. Yes. I mean, this is insurance. So, why do you have to have car insurance? I'm not going to have an accident today. Well, yeah, but you have to pay for everybody else that had an accident that day. So the nature of insurance. I'm on SSI. SSI is the Supplemental Security Income Welfare-Based Program that the Social Security administers. I understand that I will be expected to sign up for regular Social Security at 62, but what happens with my Medicaid after that? Yes. Because SSI is a welfare-based program and that money comes out of the general tax revenue, it's incumbent upon Social Security as an agency to take care, make sure they don't use, taxpayer money, that if you're entitled to Social Security retirement benefits or survivor benefits or disability benefits, they take it out of that first, what you actually paid into it those years. So if you're entitled to Social Security retirement at 62, you have to file for those benefits. And will it stop your Medicaid? It really depends on how much you receive from regular retirement. With SSI, the max you can get from SSI is $943. So if you file for retirement benefits on your own record and spouse benefits or whatever, and that benefit amount is $500, then you'll receive $500 plus another $443 from SSI for a total of $943. But if you go ahead and file for retirement benefits and you get $2,000, then your SSI stops. And in terms of your Medicaid, it really depends. It depends on your particular state. Usually around $2,000, people aren't eligible for Medicaid, but it also depends on the particular state. Some states are cheaper than others. Go figure. I've had people that were receiving, Social Security benefits and Medicaid in one state. They moved to another state and their Medicaid stopped because that new state counts their Social Security benefits while the other state didn't. So it really depends. But yes, you have to file for Social Security benefits. Anything you're eligible for, you have to file. If you don't, then they could, very well come after your SSI. So you have to file at 62. And then once you figure out, once you find your benefit amount from Social Security, your retirement benefit amount, you make sure you contact Medicaid and say, hey, I'm just going to, starting next month, I'm going to start receiving more than, I am right now, if that's the case. And then if you have Medicaid, remember, if you have Medicaid and Medicare, you're what's called dual eligible. And in those cases, I do recommend Medicare Advantage because you can't get a Medicare supplement. So Medicare Advantage dual eligible plan. Those are the ones that you see advertised, really scammy advertising they have out there about the extra, grocery card and over the counter, which they do exist, but the way they're advertised is kind of scammy. They take, the best one in the country and they advertise it to everywhere in the country that they can't get it. And you call them up and then they give you the hard sell and then they got your information and they harass you forever. But yeah, if you want to see if one of those is available in your area, call Chapter. They don't call you if you don't call them. So yeah, we don't do that toll. Yeah. Cold calling. Hi, Ed. I retired at 63 on survivor benefits. When I sell my primary home, will it interfere with my benefits? Interfere with your benefits? No, it does not. Anything like that does not affect Social Security benefits at all. The only thing, and unless you are an SSI, which is a welfare based program, but you're just on regular survivor benefits. So, no, it does not affect your Social Security benefits. As I talked about, it might. That's your primary home. If you're single, over 250,000, you get that capital gains, then yes, you might have to pay an extra Part B premium and a Part D premium for a year. It really depends on how that works out. So, but in terms of your Social Security, retirement benefits or survivor benefits, zero influence, zero effect. So, friend was on SSDI, didn't get B when got Medicare because covered under then wife's work. Okay. When divorced, signed up for B, was told he would be penalized for time not on B and nothing could do. Yeah, no, that's incorrect. If he was covered, as long as he was covered the entire time under his wife's current work, and that employer had 20 more employees, then yeah, he shouldn't be penalized at all. You just have to take a form. Unfortunately, he has to have his ex-wife's company HR fill out a form that he did have health insurance from that current work since he turned 65, since 65 into whatever date. And as long as he provides that, then there's no penalty. So, um, thanks so much for doing these sessions. They are so helpful. Wow. All right. Wow. Thank you. Appreciate it. I was scammed. Uh-oh. I took out some IRA, gave to them. Social Security looking at line 11 on 1040 wants me to pay $400 more for IRMA. How does line 11 need to change if IRA went to scammers? Oh, okay. I think you sent me an email about that. Yeah. Again, it's what you did with that money. You went and went on vacation, or you gave it to some, was it the Nigerian prince? I don't think the IRS cares. And whatever is in whatever happened to that money after you got it, for the IRS, you got it. So unfortunately, yeah, unless you can figure out a way to convince the IRS that you never got it or whatever the case may be. But yeah, that's going to be a tough sell. Social Security can't do anything to help you there because they just get the information from the IRS. So when you do your IRS, if there's a mistake or something and your employer miscategorized some income, then you refile your taxes, you amend your taxes, send it to the IRS, and then once you get your amended taxes, then you take it down to Social Security and say, hey, line 11 and 2A are different now, and Social Security will do what they need to do. So, um, according to Senator Bernie Sanders, there are 6.5 million 112 plus year old seniors still alive getting Social Security checks. Really? Congressional hearing 2 days ago. Yeah, I don't know about that. Um, in offices throughout the country, we used to have what's called a centenarian project. And the centenarian project is we used to have a guy in the office, hey Ronnie, who's in Miami now. Um, he used to go out and provide this little certificate that says, "Hey, you reached 100 years old. Congratulations!" From Social Security, and and part of it was like, "Congratulations, you reached 100 years old. Awesome." But the other part of it was exactly that fraud type thing. They were to go out there and confirm that that person was actually still out there because guess what? There are children that hide the bodies and continue to collect the checks. But 6.5 million, no, I doubt that. And over 112, yeah, I'll check that out. Bernie Sanders is usually pretty, you know, good on that stuff. But yeah, I doubt that. Senator Sanders is for removing the FICA cap. Yes, he is. Yes, which is the cap that if you make over $176,100, you no longer pay Social Security FICA, and there is the congressperson from Louisiana that just was on a video, and I'm going to do a talk about that tomorrow, and yep, there. Guess as I figured, it's time to talk about privatization of Social Security and giving it over to the Yeah, the wealth managers and the equity guys, and I guess Enron or Bear Stearns or whatever. So, yeah, so I'll talk about that tomorrow. Um, let's see. Wow, divorced 2024 on SSI, disabled, not enough work credits. Okay, recent visit to Social Security 1024. If file an X record, 66% of half of 1090. I was told must file if must. Okay, yeah, I'm sure. Yeah, not following that very well. But 66% of half. So it sounds like you've got the windfall eliminate, or excuse me, the government pension offset, because 2/3 of whatever non-covered pension you receive are offset. So Beth Prickin, a IRA. I was told any withdrawal from IRA makes no difference to Social Security. Irma, you just have to pay your fee and state taxes. I hope I'm right. Was going to withdraw some. I would reach out to someone. I have heard that a Roth IRA doesn't trigger, but the regular IRA does. All right. Let's see. You pay extra for your Medicare, but the coverage is the same. It's unfair, in my opinion. Yeah, that's yeah, way Congress again to kind of shore up Medicare. That's one of their solutions. So, why so complicated? Yes, IRMA is a 4% tax on Medicare recipients with income between 100 and 250. They could have just made it a tax. No 2-year look backs, brackets, or forms. Yeah. But yeah, I guess they wanted to say, hey, high income wage earners, but so I mean, yeah, I'm sure there's different ways to skin the cat, but yeah, that's the one they chose. My husband was over 66. His company pays thousands of employees medical. They will lower his earnings by $5 an hour if he wants the medical. Is this legal? Um, yeah, I'm not a lawyer in that respect. I'm not a labor lawyer. Uh, I've old buddy of mine, Tom DeRogi, reach out to him. He's a labor lawyer. So, but it could have been as simple as a 3.8% tax on investment income over free. Yeah. Yeah. Investment income. That's, yeah, capital gains and stuff like that. Yeah, there could be different ways. I am 54 years old. I worked at sea for 30 years. I have pain in my back vertebrae between the fourth. I cannot lift anything. My education is less. What is the chance of SSDI? Do it. File. I did 3 videos on the entire process, how to file, tips, tricks, and secrets, medical records, the appeals process, and stuff like that. If you have determined that you're not able to work because of a disability, that's how Social Security determines disability, is the inability to work, and your disability has to last 12 months or longer. So file. So file. People say, well, what about this? So what about this? Is this disabled? Is this disabled? I'm a doctor, but I'm not that kind of a doctor. And sometimes I've seen people, because I've taken hundreds of thousands of these claims, and I've seen someone who's like, okay, this particular disability, not, but they also have these other side effects, and the side effect, or the other disabilities and their side effects of the medications they use to treat this part. And so based on all that, it was determined that this person could not work. So file. Yes. Can I get my husband's Social Security for spousal support if he's in prison? Usually, yeah, if the person is prison, then those benefits stop. Divorce spouses, it doesn't affect the benefits of a divorced spouse if the person is in prison. I turned 65 last June, but I wanted to start collecting at my FRA, my full retirement age. There are layoff rumors. If I get laid off and start collecting, can I stop my Social Security if I find a job? Um, well, if you file, there's a few ways to kind of suspend or to stop your Social Security retirement benefits. The first one is you withdraw your application within 12 months. So you file for benefits and then you determine, wow, that was a mistake. So within 12 months of that application, you can withdraw your application like it never happened. And because it never happened, you have to pay all that money back. Another option is to just suspend your benefits. How do you do that? You just tell them, you call them up and say, hey, I'm going to be working. I'm going to make $100,000, and Social Security will hold back $1 for every $2 you go over. So that'll essentially, suspend your benefits. And the other way is when you reach your full retirement age, you're about to reach your full retirement age, then you can actually suspend your benefits so you can get those delayed retirement credits, which is 8% per year added on to your Social Security check up until the age of 70. So if you suspend your benefits just before you hit 67, and you don't get your retirement benefits until you restart at 70 years old, then you're going to get another 24% added onto your Social Security check. So that was a beautiful thing. The problem with that is nobody knows about that, and even Social Security employees don't know about that. I've told that, and people say, "Oh, it's a good idea. I'm going to go down to Social Security," and they go down to Social Security, and the people are, "Well, you can't do that," and so I have to provide in the reference, and so hey, Social Security employees get trained on that. So um, I turned 65 last June, but wanted to start collecting. Oh, okay, I already answered that one. I know someone who turned 65 last December, but he never signed up for Medicare or Social Security. Yeah, so you better reach out to them, and hopefully they have health insurance from work. If not, then you're going to be penalized. And if they didn't, there's another opportunity to sign up for Part B, and that is during the general enrollment period, January, February, and March. So tell that person, says, "Hey, did you have health insurance for yours or your wife's or spouse's work?" "No, I didn't have it." "Okay, well, you better hurry up and sign up for Part B. If not, you're going to get penalized for the rest of your life. And the soonest you can do it is in January." So you sign up in January during the general enrollment period, and probably going to have a penalty. And then your Medicare Part B will start in February, and then the person has to find a way to cover all the gaps, either a Medicare supplement, Medicare Advantage. So Donna, thank you for that. I know someone. That's what we want. We want. I know a neighbor. I have a brother. I have a coworker. That's exactly what we're looking for here. Is a good community. You're all looking out for other people, and you know, click the like and subscribe and all that, share and stuff like that, so more people get the information. Just curious to know if the Plan B premium is constant or changes every year. It changes every year. This year was $174.70. Next year it's $185, and so yep, goes up every year. I have tried since last year in November to get help support for Part B, get the runaround, need this and that. Yeah, so Pat is talking about probably the Medicare Savings Program, where you go down to your state Medicaid office and you apply for Medicaid. And if they approve you at a particular level, then they will pay for your Part B premium. So it's a beautiful thing. So if you know people that are having a hard time paying for the Part B, that extra $185, please, please, please tell them to go down to Medicaid, Department of Social Services, Department of Welfare, whatever they call it in your state, apply for Medicaid, and then say, please pay for my Part B premium. And then they'll pay for the Part B premium. And then so you'll have Medicare and Medicaid. You can have both. You can have both. A lot of people don't understand. You can have spouse benefits and disability and Medicare and Medicaid and the Medicare Savings Program and Medicare Advantage dual eligible plan. And so many people are missing pieces of the puzzle and stuff. So, yes, uh, yeah. And then you can reach out to a chapter there, and they can find what is the best Medicare Advantage dual eligible plan in your particular area. Yep. Surely I was laid off 2 weeks after my 65th birthday. Wow, that was nice. Nice of your boss, right? Yeah. And I lived off the 401k withdrawal until giving up finding a job after a year. Yeah, it's tough out there. Wow. Um, Lynn, Pat called chapter numbers in the top left corner. No charge. Yeah, they don't charge anything, and they look at all the reason I chose chapter. My son and I looked at all the different places because so many people were getting terrible advice and the hard sell, and people trying to sell a Medicare Advantage when they should really get a Medicare supplement, and I was tired of it. So I pulled the trigger, and my son and I looked for a place that would help you all out and that would provide you with all the information at no charge and all that kind of good stuff. And Chapter knocked it out of the park, and they've got a great customer service, or what they call it, member success team, and the member success team helps you 365 days of the year. So if you have an issue with, let's say, prior authorization, it's kind of in the news recently, right? You call up chapter in July of next year and say, hey, how can I expedite this? And I got billed for this. And how can I find a doctor and stuff? And they help you out. So it's awesome. There's not many places that provide that type of extra customer service beyond just enrollment, and have the expertise to actually do it. So take care of yourself so you don't burn out. Yes, yes. What if I retire mid 2025? When do I file the SSA 44? You can't file the SSA 44 until a decision is made. Until you receive that letter in the mail, that says we're going to charge you extra, you can't file until then. But it sounds like you're possibly already receiving that, but you're not going to retire. In that particular case, yeah, about a month or so before you retire, saying, "Hey, you know." But I think it's. I think in your particular case, they're still going to continue to charge it. They won't do it for the next year, but in your particular case, it really depends. I would definitely file as soon as you know your last day. Go in there and file that SSA 44. Let's see here. But they won't qualify because they didn't have enough quarters worked. So my question is, do you still have to sign up for Medicare? Yes, you do. Even if you're not insured for it at that particular time. Yeah, this happens unfortunately quite often. Well, not often, but more than I like. If you didn't pay into Medicare on yourself, and what I see happen is the spouse is continuing to work, and not filing for benefits, and the low earning spouse never paid. They turn 65 and they have to get Medicare Part A and Part B. Part B, everybody pays $185, so it's not an issue. But the Part A, that's the expensive one that costs over $400 or so. So, yeah, they have to pay Part A, and you're not penalized necessarily for that, but it is expensive. It is expensive. So in that particular case, I would reach out to Medicaid, because Medicaid, the state Medicaid offices, if you're eligible for Medicaid, they like to pay for Part B, because it's typical government type stuff where they're trying to move costs from one agency to another agency. So instead of Medicaid paying your full healthcare costs, they say, well, this person is costing us $2,000 a month for their healthcare. If we pay the four or five $600 for Medicare, then Medicare will pick up most of it, and so we'll save ourselves 300. They run the numbers. So good news. My neighbor is in her late 70s. She wants to know if her supplement plan can drop her coverage after she has knee surgery. No. If she needs longer rehabilitation, she's worried about it. No. If she has a Medicare supplement plan, no. And that's the great thing about a Medicare supplement plan. You don't have prior authorizations and networks and all the rest of it. Any doctor, hospital, clinic that takes Medicare takes the Medicare supplement plan. It doesn't matter which one you have. But no, it's not one of those things where, if you get in an accident, then they drop you. But no, they can't do that. Let's see. I cashed in some 401 to pay off cash for my house. Oh, okay. Yep. All right. Let's see. Answer that one. I applied twice for SSI and never approved because my husband made too much, and never was told about SSD until 3 years later. And when I applied for SSD, I was approved, but never received back pay. I would file yeah. So you're arguing that your SSDI, supplemental Social Security Disability Insurance, should start sooner because of a protective filing that you filed for SSI, and they should have taken a claim for SSDI. When you file for disability, the Social Security employee is what we call have to address both programs. Anybody that files for disability benefits, the Social Security employee is supposed to file a claim for SSDI and SSI, both programs. What happens often is the Social Security employee doesn't tell you that, hey, your spouse is working, you got a bunch of money in the bank and all that kind of stuff. So we're going to apply for SSI. We're just going to go ahead and deny it, and you're going to receive a denial letter in the mail. And then people receive the denial letter about a week after they file for benefits, and they say, "Wow, it was turkeys at Social Security denied my disability after only in a week. They didn't get any medical records." No, that's just the SSI port, because you're not low income, not low resources. They're still working on your SSDI. But in your particular case, if they should have addressed that SSDI 3 years ago, you could very well appeal that decision. And it's through a SSA 561, a request for reconsideration. You file it and say, on the request for reconsideration, there's only a few lines there, so you can just write "see attached" on the top of the page, and then attach, a piece of paper, and put a little, details and whatever evidence you have, and then submit it to have them make copies, make them stamp it, and initial it and all that kind of stuff that they received it, and yeah, and then see what happens. But I got to warn you on any type of appeals when you're appealing the date of onset. So you're appealing basically when they determined your disability began. Anytime that you appeal the date of onset, you're reopening the case. So sometimes it happens that because another person will look at it, and that other person might decide, wow, this person should have never been approved in the first place. Forget about an extra year of benefits. They should have never been approved. So yet you're unfortunately taking that chance. So chapter staff are very helpful. Awesome chapter team. Oh, awesome. Thank you for letting me know. Appreciate it. Got IEDS. Thanks. Just got a letter saying you're entitled to monthly husband's benefits on the record of XXX beginning August 2020. Wow. Manager did say I'll get back pay. They're a 4-year list, had SSI. Awesome. Awesome. Good deal. Yeah, that's a lot of people. So look at it. All the people that pressed like and subscribe and shared these videos and stuff got to Tony. That's how Tony got that information about the independently entitled divorced spouse benefits. And then he went down there and he got his money. So it's, I always say it's not me. I'm just, some idiots blabbing in front of a camera for an hour a day. If it's just me doing this, then it's not going to help anybody. It's y'all that share this and get this out to more people. So Tony, thank everybody, Jen and Deborah and Phyllis and Purple Love and all these people that, share. So awesome. Okay, what is independently entitled divorced spouse, IEDS? It's basically if you're 62 years old and you start your retirement benefits and you had a divorced spouse, you're potentially eligible for benefits on that person's record. If your benefits are less than half of their full benefit amount, then you could be eligible for the difference. But what people get wrong is they think the ex-spouse has to be receiving benefits for you to receive benefits. That's not the case. That's where the independently entitled part comes in. As long as your ex-spouse is at least 62 years old, it doesn't matter whether they have started their benefits yet. And you had to be divorced for 2 years. The final divorce had to be for 2 years. As long as you're good on that, then you can get those extra benefits like Tony there. So, and this is another thing that people go down to the Social Security office and they're saying, hey, I want to file for this IEDS. And the people at the front window say, there's no such animal as that. Because the people at the front window, unfortunately, are generalists. They're called CSR. They're the lowest paid people in the Social Security office. And unfortunately, they're the hardest working, if you ask me. But they're generalists. They have to help with everything. You really have to talk to what's called Title II CS, a Title II of the Social Security Act, a claim specialist who is a specialist, an expert in retirement and disability and all that stuff. So if you go down there and ask for IEDS and they say there is no such animal, then I'll put as I almost always do, I will put the reference. Let's see, where is it? IEDS. Okay. I'll put the reference in. So if you know anybody, again, share with all the people, next time you're, talking with your friends or something and say, hey, weren't you married to someone for a while? And why aren't you getting benefits on that person's record? And then if they say, oh, I'm waiting, they haven't filed for benefits yet. And then you say, guess what? You're about to get some more money possibly. So yes, there's the reference for independently entitled divorced spouse. I put it in the chat below there. So, all right. I'm going to be jumping around here. We're running short on time, and let me get people that I haven't seen before. What is the current cap on how much a person can make weekly, monthly before getting a penalty? Being on SSDI soon 65, and it's like impossible to live. All right. So I did a couple of videos on that. So I've done close to 800 videos, but The one on the top is disability and work, and I go into all of the details about working and receiving disability benefits. So definitely check out that. But basically, you have the first 9 months. You have what's called the trial work period, where you can work and make as much as you want for 9 months, and that don't have to be consecutive. To try to see if you can go back to work. And then after you exhaust those 9 months, then you have 36 months of called the extended period of eligibility. And that anytime you go over the substantial gainful activity, a lot of terms, right? SGA, it's anytime you go over $1,620 for 2025, they stop your benefits. So you can still work, and to trigger a trial work period for next year is $1,160. So if you're on disability, just SSDI as you are, you can make up to $1,000. Actually, make up to $1,159. I wouldn't stay that close. I would, always go a little bit under so you don't, no red flags there. So yeah, you can make $1,000 a month and nothing happens. You can do that forever, essentially. And remember, once you hit your full retirement age, whatever it is for you, 66 and 8 months or 67, you're no longer on disability anymore. You switch to regular retirement benefits. So there is no more work limitations. You don't have those CDRs, those continuing disability reviews. You just go on with your life, and it's a beautiful thing. So, Juanita, how long do I have to wait till SSI reimburse me for my Medicare Part B premiums if I have Medicaid in Florida? Okay, good question. So it usually takes about a month, 2 or 3. So if you apply for Medicaid and they say, "Yes, we will pay for your Part B premium," then the state Medicaid computer system, which I used to work for Medicaid before I worked for Social Security, and in our state, the Medicaid system was terrible, the computer system. So they have to pay for it, and you've got 3 different agencies, 3 different computer systems. You've got the Medicaid, your state Medicaid, you got Social Security, you got Medicare. So those 3 systems have to talk to each other, and they're all based on 1700s technology, it seems like. So yeah, it usually takes a month, 2 months, 3 months. But the month, if you overpaid, if they're taking it out of yours, and the Social Security system sees that they paid twice for 1 month, then they will pay you that money back. But unfortunately, yeah, it does take about a month or 2 to kind of clean out through the wash there. I wish it was a lot faster, but it is what it is. All right, let me jump around here. Let's see. Bernie Sanders freezing his off in the Northeast and removing FICA for kilometer like a okay. Yeah. Um, 63 on SSDI with Medicare Part A and B. Am I eligible for supplements? It really depends on your particular state. If for a Medicare supplement, a plan N or G or whatever, there's 10 different letters. Most people get the N or the G, and before it was F was the predominant one, but now it's N or G. Um, in most states, you cannot get a Medicare supplement plan if you're under 65 years old, but because those companies don't want to give you those, and your state regulators are not making them, because the reason they don't want to give you that, they don't want to sell you that, is because you're under 65. And if you have Medicare under 65, that means you're on disability and you're going to cost them a lot of money. So that's why they convinced your state legislators not to force them. So some states do. Um, but it really depends on your particular carefree highway. Is that Arizona possibly? I don't think, yeah, you can get it in Arizona, but you can call a chapter and you can tell them what state you're in, and they can see if you can get a Medicare supplement in your particular state. Whether you can get it, and some states say, yeah, we'll make the health insurance company give it to you, but we're not going to regulate how much they overcharge you. Well, not overcharge, where they charge you more than the regular person. So if the regular person is paying $100 for a plan N, if you're 55 and receive Medicare, maybe we'll charge you $400. And so it really depends. There's that variable too. So reach out to chapter, but you can always get a Medicare Advantage plan. And if you get a Medicare Advantage plan because that's the only thing available to you, you're coming up on 65 here in no time. So you get a Medicare Advantage if that's the only thing available to you. And then when you hit 65, then you're in a new window. you're in the 65 window, so you can get whatever you want. So you can get a plan N, G, whatever, and they can't charge you any extra. So that's a beautiful thing. A lot of people miss that. All right. I called my friend and asked if she had A and B. She said yes and told her to follow you. Okay, awesome. Wanda, appreciate it. You're awesome. If you're in the Navy, okay, I almost said that incorrectly. Tell the doctors you're seasick. You see mermaids and daddy long. Okay, okay, whatever. So, yeah, yeah. I'm an old Marine Corps sergeant, so I got to throw a Marine Corps joke in there. Yeah, where the Marine Corps is actually a department of the Navy, the men's department. So, dun-dun-dun. All right. Um, how do I get a hold of your lawyer, please? Yeah, I probably shouldn't have said his name. It's an old college buddy of mine that happens to be a labor lawyer in California. So, but yeah, you can reach out to any kind of labor lawyer, whatever state. You can reach out to the American Bar Association. What I would recommend to start with is go to, if you have a university that has a law school, a lot of those law schools have like a legal clinic. So I would reach out to them because it's usually free. I think almost always free. It depends, what level of request you're requesting. But yeah, I would reach out to them and say, hey, here's my issue. Can y'all help me with it? Or if you can't help me with it, can you recommend someone that can help me? So definitely do that. 66 and 8 months in March 2025, planning to retire in January. When do I submit a request to start my benefits? Okay, so you're full retirement age in March, but you want to go ahead and get those extra delayed retirement credits added on there. Work is not relevant anymore after March. Probably you can start your benefits in January if you want to, but for whatever reason you want to start January of 2026. Um, then yeah, a couple months before you can, file online and all that kind of good stuff. And I'm assuming because you're 66 and 8 months, maybe you already have Part A and Part B or just Part A of Medicare. And if that's the case, to sign up for the money benefits, it's super, super easy because you're already in the computer system. You've already, proved your age and your, citizenship and all that kind of good stuff or legal presence in the United States. So once you've signed up for Medicare through Social Security, Medicare Part A, B, pay Part A and or B, then to start the money benefits later is super, super easy. So it's difficult, a little bit, tad bit difficult the first time, but yeah. Let's see. Can you believe it? You're penalized if you don't sign up for Part B. Just sign up and sign out, Mr. Eunice. Huh. Yeah, yeah, because it's insurance, just like anything else. Car insurance. I'm not going to have a wreck today. Why do I need car insurance? And then you go in when, okay, hey, I just had an accident. Can you sign me up for car insurance today? Not so much. So the money you pay and the premiums you pay are paying for all the people that are having accidents that day. So the premiums you pay for Part B are, even though you're not using it, it's paying for the people that are using it that day. So yeah. Oh yeah, signatures. 971 signatures on the petition. Yes, please sign that petition. Please, please, please. Why does Wisconsin not have Plan G and N like other states? Confusing. Yes, Massachusetts and Wisconsin. I don't know if there's another state they do. Yeah, these other weird things. But you can get like a kind of a G or an N lookalike. I think in Massachusetts it's like a 1A with a rider or something. Yeah, so they're they're confusing. So. I am 67 years old. I'm retired. I have Medicare and Medicaid. I live in New York. If I move to California, can I apply for Medi-Cal there? Yes. So Medicaid in California, because California always wants to do everything a little bit original, they call Medicaid in California Medi-Cal, which looks like the term medical. But yeah, it's too confusing. But yes, absolutely. Yeah, anywhere you move to, you can apply once you move to a new state. Absolutely. It is a guarantee that whatever you pay for anything today will cost at least 10% more next year. Yeah, yeah, it seems like it, right? Apply for Medicaid, go clean for a month and take a blood test and apply for 401. Okay, I'm not sure. Let's see here. When I check my Social Security statement, it shows an amount of $2,300 per month I would receive if I started my benefits. When I use the calculator, it shows about 300 to 400 less. Why is that? Um, It depends. The closer you get to your full retirement age, the more accurate it is online. Because what happens is it's projecting forward. So if you're 55 years old and you're using the online estimator through my Social Security, your that letter they used to send out once a year. If you're looking at that, what it's doing is it's saying, okay, you're making about this much every year recently, and we project you're going to continue to make the same amount until you hit your full retirement age. So if that's you're going to continue to work about the same amount for the next 17, 12 years or whatever, then here's how much your benefits are going to be. But what happens is sometimes people look at that and they say, "Oh, $2,300. Oh, okay, well, I'm good. So I'll stop working for the next 10 years and wait for that 2,300." And by the time they get there, that's 1,700 because it wasn't added on there. So, yes, that's why it projects in the future based on recent work. We did that when my husband turned 65. We got a letter saying the state stopped paying even though he wasn't working. Is he being penalized for Part B? Um, if so he got a letter that said the state stopped paying. So he was his part being was being paid by the state, and then the state decided to not pay for the Part B anymore. Um, Possible what usually happens is because you have Part B, they just take it out of the Social Security check. So are you sure they're not already taken out of the Social Security check? But if they're not, then he doesn't have Part B. Yes, he'll be penalized 10% for every 12 months. And that's another thing that a lot of people are missing is they get kicked off of Medicaid, and then Medicaid stops paying for their Part B, and they are now responsible for it. And again, you're penalized if you don't get it, but usually it's just you just have to start paying for it yourself. But if you're kicked off Medicaid and you have one of those Medicare Advantage dual eligible plans, then you lost that Medicare Advantage dual eligible plan and you have to switch to a regular plan, because if you don't, then the next month you go into the hospital, a doctor or something, and you show them that card that you've been using for the last few years, and they say, well, no, that one's been canceled. You need to find a regular Medicare Advantage plan or a Medicare supplement plan because the dual eligible plan has been canceled because you lost your Medicaid. So yeah, that's the whole thing is way, 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 way too confusing. So I just went through the appeal process and got the extra charge removed. See, there we go. It does happen. Had to prove of divorce and proof of 2024 income, which was significantly less, putting me below the first bracket. There we go. See, she did it correctly. Did the SSA 44, the life changing event, said, hey, I got divorced and my income has been reduced. I stopped working. I got fired. I got laid off. I reduced my working, whatever the case may be, and they approved it. And yep, it's a beautiful thing. I like it. Retired in 623 and filed for Social Security as well as for DIB pensions. Also got a lump sum back payments for two of the disability pensions. SSA included the lump sum in my IRMA this year. Worth asking for reconsideration. Always worth asking. Yep, the SSA 44, fill it out, return it, get a copy of it that they received it and all that kind of good stuff, and wait and wait and wait and wait and wait, unfortunately. So, all right, let's see, get a couple, we're running out of time. Got a couple more questions. Let me find someone that I don't see here, haven't seen here before. Um, yeah, why does everything have to be so freaking difficult? Exactly. Yeah, Social Security policy alone is over 20,000 pages. It's crazy. But all right, let's see. Decided to file early at 64 and got approved since May of 2024. I earn about 28,000. Social Security recently sent me a letter that they will rescind the approval and stop paying in 2025. Um, so got an so we're talking about disability or retirement. So yeah, it's got to be disability, because in terms of it could be, yeah, they're not going to rescind your retirement. They're just going to withhold benefits if you went over the annual earnings limit. So, but if they're going to rescind the approval because of work, um, yeah, you're way, way, way over. In order to be approved for disability for this year, um, It's what 1560. For next year is 1620. So anything 1560, yeah. This year is flying by so fast. But if you're over the substantial gainful activity, then you're not eligible for disability. Yes, and it sounds like yeah. Any way you slice it, if you're making $28,000, you're not disabled according to Social Security because you're making over substantial gainful activity. So yes, that's definitely what they're going to do. So let's see. Okay, this will be the last one here. I got a letter from SSDI saying I have another income, which is a lie. They are asking for my bank account statement to prove I have no other income from the application. Extra help Part B. Oh, okay. Yeah, for SSDI, they don't care about any other income unless it's, a workers' comp type public disability. But other than that, yeah, they don't care about extra anything out other income coming in. But if you're filing for extra help with your prescription drugs, that program, then that is a income related, needs based program. So if they see other money coming in other than your social security check, then they're saying you don't need extra help. So yeah, but sometimes, hey, the computer systems are wrong and it's some income, whatever that um, yeah, if it's not your income, you just prove it and say, "Yeah, that's not my income, and I don't have that money coming in." So, yep, there you go. All right, that's it for today. I'm gonna be back tomorrow, and we'll talk about yeah the attempt to privatize Social Security. It has begun, so let's talk about it and stop it like we did before. If that